With baseball and softball season in full effect, a lot of athletes out there are having some shoulder issues. And one of the things you can do on a daily basis is some self-arm care. And that is not ice. Not ice. It's getting some motion, some exercise, some topical analgesics, and a few things in through here. Now, this isn't going to be a cure if you have existing shoulder problems. It may help lower the pain threshold, but it's a nice way to take care of some tissues from getting worse and beat up throughout the length of a season. So the first one, get yourself a nice foam roller. I'm going to assume you're right-handed, if not, just invert. Put that underneath on alongside your outer shoulder blade right in through here. You're going to turn into it. You can use your legs to take up some support, lift up your hips, and glide till you find that flavorful spot that makes you want to kind of like pull your hair out. Once you find it, drop your hips back down. Now from here, you can do what we call an active release technique. Engage your muscles, maybe pull your arm down into the foam roller, engaging that tissue. Couple, 3 seconds, relax, engage, breathe through there, wash, rinse, release. After that, come back, find the next spot. Where's it the most tender now, most flavorful? You find that spot, boom, drop the hips back down. Find a way to make that muscle contract. 5 times, 6 times, 8 times, it takes what it takes, but keep going through there. From there, make yourself a nice peanut roller. 2 tennis balls, not lacrosse balls. This is not going to be beneficial. 2 tennis balls in a sock and something. You're going to put it right behind your neck, between your shoulder blades. You're going to lift your hips up. You're going to drive till you find that tender, flavorful spot. Once you find it, drop your hips down. Now from here, let's get our arms involved. Start making little motions, pulling back into the ground. Come back up, make some capital T's, come back up, make some 1/2 of a capital X. Maybe drive your elbows down in the ground. Maybe change the angle. Shouldn't have pain with this. It should feel like a release of a tight muscle, tight knot, not pain. Again, back to the top. Hips up, roll and find the next level. Drop the hips down, move the arms, breathe slowly and deeply into that belly button. Give yourself a nice big poof. After that, now we can find a lacrosse ball or even an oversized bouncy ball, which are very beneficial. Let's go find a wall somewhere. So we have these rotator cuff tissues on the very back of our shoulder blade, and they can be very, very sneaky. A lot of anterior shoulder pain in part is due to some knots in our infraspinatus muscle tissue back there. So with a lacrosse ball, or I prefer an even smaller bouncy ball, I can put it up against the wall, and you can maybe come around here. You're gonna kind of roll up and down till you find that spot that again makes you kind of almost want to pull your hair out. Once you're there, stop. Just stay parked on there. Take your hand, move it from your stomach, up and off and away, like a tennis backhand motion almost. And just breathe and relax and slowly work through there until that spot starts to let go. It may take 1 minute, it may take 2 minutes, it may take 3, 4, 5 minutes. It takes what it takes, but work through there. And again, once that spot feels better, come back, move around, clear that entire shoulder blade, and wherever you can, pin it, move it, release it. Give these things a try. Again, these aren't cures per se, but it's good strategies to keep those tissues moving and grooving, and it beats icing every day of the week. Give them a try.